We're going to give everyone here about 2 or 3 more minutes to get logged on before we get started. Thank you, Marianne, for letting everybody in. For anyone new jumping on, welcome, welcome. We're going to give everyone about 2 more minutes here to get settled and get on before we go ahead and get started with the panel. All of your headshots, by the way, are so cute. Welcome everyone who's just jumping on. I know we're adding in some more students right now. We're going to give it about 1 more minute here before we kick off, but thank you for being here today. We have so many students joining us here on Leap Day today. I totally forgot that today is our extra day out of the year. So thank you everyone for spending your special extra day with us. Alrighty, okay, well, it's 12:30. We're gonna go ahead and get started. We'll definitely have, I know, quite a few more students probably join on in the next 5 or 10 minutes or so, but since we have everybody here, we can go ahead and kick it off. So welcome everyone. My name is Heather Raposa. I'm the Internship and Job Development Specialist here at the Career Development Center. Again, thank you so much for joining us today just to learn a little bit more about some of the career path options that you can take within the healthcare industry. To give you all a brief overview of how today's event is going to go, we're going to first go ahead and start with an employer panel, and then from there, we're going to move to a Q&A. I just ask that you please reserve any questions that you have until the end of the event. In case we're not able to get everyone's questions answered, all of the panelists have very kindly offered up their emails, so I can go ahead and send you their email address to ask them any questions directly. If either you don't feel comfortable sharing your question on the panel, or if we aren't able to get to it at the end. So no worries there. And with that being said, I'm excited to introduce you to our 3 panelists today. We have Nada Hamden, Emmeline Kim, and Nicole Ludwig. So to kick things off, would each of you panelists please share with me your current job title and employer, a little bit about what you do in your role, any degrees and certifications you may have, and why you wanted to work in this field. And Nicole, we can go ahead and get started with you.
Okay. Hi, Heather. Hi, everybody. My name is Nicole, and I currently work as a registered nurse at Miller's Children's and Women's. I work on the mother-baby unit, also known as postpartum. I've been there for about, I want to say 3 years now. I just work as a unit staff nurse there. I started as a new grad, straight out of nursing school. So basically a day-to-day basis, I'm, assessing patients, taking care of their daily needs, communicating with doctors and the patient, advocating for them, taking vital signs, looking up for the mom and the baby, both of them at the same time. It's a lot of communicating, a lot of, interacting with direct patient care. For my job, degree-wise, you have to have a bachelor's of science in nursing. And then there's a couple of certifications like we do, like BLS, basic life support, and then neonatal resuscitation. Some units they do require ACLS depending on what mother baby unit and what hospital you work at, but those are the main two that are required for my specific job. And then as to why I wanted to be in nursing in general, just I've always wanted to be a nurse. So I originally wanted to start as a pediatric nurse, and like that's what I want to do my whole life. And when I went to nursing school, I actually really fell in love with OB, and that's kind of, I was like, I'll do OB or pediatrics, and I ended up in obstetrics in postpartum, and I absolutely love it, and I wouldn't change it for the world. So that kind of, I guess, hits everything.
It does. Thank you. Emmeline, you can go ahead and go next.
Sure. Thanks for having me, Heather. I'm very excited to be here and speak to all of you guys. My name is Emmeline. I am the program manager for the Cope Health Scholars Program at Hoag Hospital in Newport Beach and Irvine. I am basically here to represent more of the management and administrative side of healthcare. So I'm sure a lot of you maybe are thinking nursing or, maybe the med school route or something closer to the clinical side like Nicole. And when I was in your shoes in undergrad, I actually thought the same. So I came in thinking, maybe I want to do clinical work. I love the idea of being a doctor. My dad is a physician, and so I thought I might follow in his footsteps. And then I actually did the program that I run now, which is essentially a clinical internship experience for you to get just hands-on clinical work in an inpatient setting. And then I very quickly realized that I did not love bodily fluids, and that was just not quite my thing. And so, yeah, realized that pretty early on in my undergrad years. And then one of the rotations through the Cope Health Scholars Program was on the patient experience department. And so through that, I was able to get exposure to this whole other side of healthcare that I think a lot of people really just don't know about, especially in your undergrad or early years. There's so much to management, whether it's HR or quality assurance or patient safety, patient experience, more the data-driven side of things. And yeah, I think that was my first experience to kind of this whole other world of healthcare. And I very quickly fell in love with it. I think sitting at a desk and maybe not working directly with all of the patients was more was suitable for kind of my strengths. And so I love being at this intersection of business and healthcare and being able to still help people and do meaningful work, just kind of in a more indirect way, in a way that most people don't usually think about. So I'm excited to kind of share more about, that side and all the different facets of administration. But yeah, hopefully that answers all of the different parts, Heather.
It did. And also just, we actually do have some of our College of Business students here with us today, as well as public health and public administration. So there definitely will be students here today that will want to hear from your side of working on the more business side of working in healthcare for sure. And then, we can go ahead and pass it back to you.
Hi, everyone. My name is Netta. I'm a recruiter here at APLA Health. I have been at APLA Health for about 6 months, but as far as like my journey, I started out working for a healthcare agency as a coordinator. And then over time, I realized I wanted to get more into the nonprofit public health kind of area, because like agencies a little bit different. Like we work with healthcare organizations and like help staff them, but in time I realized I wanted to work for those healthcare organizations directly. So eventually I made my way through. I think I ended up working for a nonprofit organization, I think through a referral from someone that I knew that happened to also work there. And then eventually I spent quite a few years working there, and then I moved to LA, and now here I am at APLA Health.
Thank you so much for sharing. Now this next question, you probably kind of addressed, I think all of you actually addressed this a little bit, but I'm going to ask it anyway in case there was anything you wanted to kind of go a little bit more in detail about. And then Nicole, you can start with you again, kind of on the same order. Can you please share how you got your first job in this current field? So actually that may have been at another hospital. And were there any challenges that you faced in that process? And then if yes, can you please explain how you got past them?
Okay, so I graduated in 2020, so right during literally the middle of the pandemic. I graduated like towards the end of 2020. I was originally working at another hospital. I was working at UCLA as a patient care assistant, and it was honestly really, really hard to get a job during that time because I didn't want to work in med surg and I didn't want to work in ICU, and that was all they had at the moment. So I kept reapplying, and then I got a job about a year later at Miller's, and was offered a job there, and that's been my first job since. And it's just, you kind of start like your specialty wise, like you don't really get everything like you're, I guess, educated on in nursing school. You kind of like learn on the job. So I don't know, is there anything else that I missed in that question, Heather?
No, not really.
Okay.
No, I think you hit everything. Yeah.
Okay.
Well, and I'll definitely be asking you more about like those, I guess like some of the things that you couldn't have predicted when you were in school that I think you just started to hit at, but we'll
Okay.
get to that. We'll get to that later. Emmeline, you can go ahead and go next.
Sure, yeah. So like I mentioned, so I did the Cope Health Scholars Program when I was an undergrad. So that's how I still had connections to the program. I love the value that it brought to all of my, fellow students that were going through it. And then obviously it was really crucial in me figuring out what I wanted to do for the future. So I still stayed in contact with my boss at the time, who is now my coworker and colleague, which is really cool to say. And so having those connections were definitely really helpful in getting this job here. I will say I didn't really touch on my undergrad degrees and things like that, but I studied economics in undergrad, which has literally nothing to do with healthcare management whatsoever. And so if you are, also in a similar boat or thinking, maybe I want to switch into another career or something like that, know that yes, you take advantage of your undergrad degree, but at the end of the day, it's more your experiences that you get, the internships, the people that your network, rather than, the degree name itself. And I think I'm living proof of that too. I will say I am in the process of planning on getting my master's in business administration, but a lot of people in my career also do master's in health administration or a master's in public health. And so there's a lot of different options and avenues to be in this field. But yeah, in terms of other challenges, I think, yeah, we also economically just, right now the job market is hard. And so it's hard for anybody to get anything anywhere right now, no matter what field, healthcare or not. And so I would definitely lean in, especially if you're thinking more the business administration side. People always joke, but it's so true. It's not what you know, it's who you know. So definitely, I'm sure we'll touch on this more, but the network that you create, like put yourself out there, put yourself in front of people that know people, and yeah, don't be afraid to kind of put yourself out there, because that's definitely, you can't, at this day and age, all interviews and even entry-level positions, it seems like you have to have some sort of experience, even though it's entry level. So it's not really entry level. And so those connections will be really helpful in the future. Yeah.
Thank you. And then Netta, I'm going to change the question just a little bit for you. Like, did you always know that you wanted to work in healthcare? Because I know you said earlier that you had started in like working more for like healthcare agencies. So kind of how did you even land in working at a healthcare agency to begin with?
Yeah, it's funny that you asked that, because I'm on the same boat as Emmeline, in the sense that I was an English major. I was a creative writing major, and I was like, I'm gonna move to LA and write scripts and do all the things, and I just kind of fell into that job because I had a editing position prior to, and it was awful. So I was like, let me not stay in this industry. It's not really what I want to do. So with the coordinator position, it wasn't intending to be like a long-term thing, but over time, the more I got to learn, like, because I spent a lot of my time speaking to healthcare professionals and just seeing their passion for it, seeing how like, eager they were to get to work and help people like that, and being able to help them find work, like that kind of reward for me was like worth it at the end. So because I started to like kind of enjoy helping them try to find the best fit for what they were looking for, that's when I kind of decided to continue on in that, but eventually I wanted to work directly for like those hospitals, just because an agency, it's more like sales focused, and I'm not really big on like a commission based type position. I just want to help people. I don't need to like make it into like a numbers game. So, yeah, so I ended up like kind of transitioning into that and working closer into the healthcare like industry. But I when I was younger had wanted to actually get into pediatrician too, which is funny that Nicole said that. But over time I was like, I don't know. I was like, I don't know if I want to go through the schooling, and the more that I was like in the hospitals, I was like, I don't think like clinical is for me, like patient care. So just being able to help people, and then through time eventually like outside of healthcare, I wanted to focus more on public health because I wanted to be more in the community and work within the community a little bit more. So that's why I went like nonprofit and then public health and kind of like tried to veer my way. But I agree with Emmeline, like a lot of the jobs I was able to get were because I knew people who were already working there through like volunteering for those organizations. That's like a big thing. Like if you can volunteer, if you can like make connections. I always, anytime I with any of my previous supervisors, managers, or even people that I met, I always added them all on LinkedIn, because eventually like having a way to contact them later on and being like, because like I was laid off last year from my job at the time. And I had the opportunity to reach out to people that I had made connections with in LA and be like, who do you know? Who do you know is hiring? Can you help me? Like, you just kind of have to like throw yourself out there, and sometimes you catch something, and that's how I was able to kind of get that way in and get that position. Because it's true, like as a recruiter, I can say the market is really tough on both sides, like for candidates and for organizations. Like they want people, but with just like cost of living and rent, and then what we can afford, what we can't afford because of our budget, it is tough to we try to do our best to get people in, but it is really tough out there. So make as many connections as you can. Like that's really what will help you, because when people are applying, we're getting like so many applicants that it's really hard to like get through, everyone. So like, but if someone's referred, then they might take priority, over an online application. So yeah.
That makes a lot of sense. Thank you. Thank you both of you, and Emmeline as well, for kind of sharing some of those tidbits. There'll definitely be a time at the end also for you to share any other advice that you have for students, as well. Okay, so our next question, Nicole, can you share a little bit about what your educational program was like, specifically what the most challenging parts about it were? Before, this was going to be mainly about your Bachelor's of Science, but if you could also discuss the specific certifications or that you got specifically for your current job, that would be great. And then also, because, and maybe other people know this and I just don't because I'm unfamiliar, but if you were to go into any specialty as a registered nurse, would you have to get specific certifications after your Bachelor's of Science in nursing?
Okay, so I went to Loma Linda University for my undergraduate. I actually had a previous degree I was originally trying to go nursing route, but it is so hard to get into the nursing program just in general, especially in California. So I got a previous degree in kinesiology. I ended up transferring to Loma Linda after I graduated from my first degree. And then my degree, like my program was like very like rigorous, and it was very challenging. It's probably one of the hardest things I probably ever have done. Lots of crying sometimes. And then there was days where you had like better days, sometimes you go and you're just like, why am I doing this? But then the other days you're like, why am I doing this in a good way too? So it's just kind of like a give and take. And I feel like that's kind of how it is, like just in general in the healthcare field. Like you have your good days and your bad days, just like anybody does. But I think the hardest thing probably was just like, you really have to dedicate your time to like really learning the material, and like also give yourself grace. Like it is a very hard program, just no matter where you go. But really lean on like your classmates a lot. I know I had like a good group of people that I would study with all the time, and you know, we would like ask each other questions and like, you know, really like build each other up to make sure we would all pass, because like everybody wants to see each other succeed. So, and your teachers, if even if you might not believe it, but they really do want to see you succeed. I know I had multiple like conversations with teachers just because I was like, sometimes I was struggling in certain areas, or, you know, that part of nursing was just not my strong suit. Like psych is just, for example, not my thing. But you know, of like obstetrics is not other people's things, so it's just a give and take. But they do really want to see you succeed, so making sure you're talking to your like your teachers, and if you can get extra help, take it. Like take as much help as you can, because you know, one person's explanation of explaining something is not for you, but then another person's is, you know, like right up your alley. So I think that's probably the one of the things I'd recommend, and like things that I struggled with when I was in my program, because just because it is such a rigorous like process to go through. Sorry, Heather, what were the other questions you were asking?
No worries. For if anyone is going into a certain specialty, like how your specialty would be obstetrics, do you have to get additional certifications even after your initial degree?
Yes. So depending on the type of specialty you go in, it will tell you like on your like on the job you're applying for what they're looking for. Generally, like the more um like how do I say this? Like critically cared for patients, you have to have more certifications for. And it will specify, and generally like it doesn't change per hospital. So obstetrics, typically you need to have neonatal resuscitation, like NRP, and everybody generally needs the like basic life support. As you go up and like critically cared for patients, you probably need like advanced life support for adults, and then there's also one for pediatrics. It just kind of depends, and but it will state on like the jobs that you are looking at. So I would recommend, if there's a certain specialty you're looking at, kind of look into that. Sometimes I know a lot of times for when you're already in your field, they will pay for your um, like certifications and things like that. I'm not sure how it works when you start off, because I already had done it beforehand just to kind of get a leg up from other participants that were going through the job application process with me. So it just kind of depends on each specialty, but definitely look for that when you're looking at different jobs. So.
That's really helpful. Thank you, for sharing that information. Neda, next question is for you. Can you please share with us, what the main components and tasks of your job are? And can you share also what your favorite and the most challenging things are about working in healthcare?
Yeah, so just like a summary of what I do. So essentially, I help the managers in our organization review resumes for different positions and help them like coordinate interviews. And then if you are able to, like, if you end up getting offered the position, I'll be the one that offers you and kind of helps you through that onboarding process. So it's basically I'm there throughout the whole entire hiring process. So I just try to help the managers pick someone and get them in as soon as we can, typically, because we're always looking for more people. And then challenges. So, I mean, there's just challenges in healthcare in general. I think, especially after 2020, things like everything has kind of shifted when it comes to what healthcare professionals want, and just like burnout, for instance, that has made like a huge impact, like this, the kind of positions they're willing to do. And it is also just much harder to get people in because um with healthcare professionals specifically, everyone is trying to especially like nurses, like everybody wants them. Physicians, like everybody wants them. So they're getting like all types of emails and calls and things like that. So you really have to make yourself like stand out, I guess, versus like, other organizations, or try to appeal to them in some other way. So that's probably like the biggest challenge, is really trying to appeal to them in that way to make them want to work for us, because they get like bombarded all the time with, phone calls and emails and things like that. So I feel like that's probably one of the biggest challenges in this industry right now, because it's shifted a lot since COVID. Like, because like Nicole mentioned, typically the process was that nurses would come in with through med-surg, like working med-surg, but that really changed like over the last few years, where like they don't necessarily have to work in med-surg first. They can go straight to like women or ICU, NICU, whatever that is. So it's just changed how we kind of have to approach it with them and try to do the best that we can. I do the thing I enjoy the most is trying to, I think, because especially with APLA Health, like our mission is to help those, we specify in helping those who are living with HIV and just underserved communities as a whole, like specifically LGBTQ community. So like my favorite part for me is being able to bring people on board who are really passionate about wanting to help them and wanting to make a difference in the community. Like that's probably the most rewarding part for me, is to be able to like guide them in this process. Cause like I'm the recruiter in the sense, like I'll help guide you. I don't get to make any decisions in the process, but I can do my best to like help you get like the pay rate that you're looking for and the, just specific details like that I can try to help meet you where you're at and what you're looking for by trying to appeal to upper management and trying to sell it as best as I can with what they've given me. So when that works out, when I'm able to really do that for someone, it's probably the best part, I think. And also just talking to healthcare professionals, most of the time they're just hearing how passionate they are, and even just public health in general, like those who are so like just invested in public health. It's just really nice to be able to talk to them and have that kind of like understanding and bond over that. So yeah.
Thank you for sharing. Okay, my next question is going to be for Emmeline and Nicole. And Emmeline, you can go first. But can you both share what your day-to-day looks like in your role, and anything about the position or the industry that had initially surprised you? And so I think I made a little mention of this earlier, but so what I really want to try to get here is expectations versus reality. I feel like there's only so much that a student, that any of us can know about an industry without actually working in it or having experience in it. So I kind of want to debunk any, maybe let's say, unrealistic expectations that we may have, or any inaccurate assumptions that we also have about the industry and about working in the business side of healthcare, and then also the clinical side of healthcare.
Sure, yeah. I'll just first off echo what you just said, Heather. I really don't think anyone's able to fully understand a role until you're in it, right? A lot of it is just learning on the job, and I think that's clinical, not clinical, anything. So we'll do our best to kind of share, but I'm sure there's a lot of pieces that we're gonna miss. Before I share kind of about my specific role, I'll say for health admin in general, day-to-day looks so different depending on what department you're in. Just like there's a million departments and units for different types of, say diagnoses or, things that patients need to be treated for. There's also a million different departments that you would have never have thought existed within the hospital setting. And that doesn't even include outpatient too, right? So if you're in a clinic or, working with, there's even pharmacies or like even big corporations like the CVS's or the, other healthcare, not hospital setting. And so it'll kind of depend on where you're at. But for my position specifically, so like I mentioned at the beginning, my title is a program manager. And so I'm actually employed by a healthcare consulting company called Cope Health Solutions. They basically, consulting is kind of a whole other healthcare branch in and of itself. And I'd be happy to share a little bit because I dabbled a little bit in there earlier on in my career. But yeah, that's kind of a whole other like sales and going into hospitals and how do we do process improvement, that kind of thing. It's a lot more strategy. And then there's a workforce development branch within our company, which is the part that I am in. So we contract with different hospitals to basically put on this clinical experience for the hospital themselves. And so my role overseeing the whole program at Hoag Hospital is kind of threefold. So one part is recruitment. So I'm on college campuses, I'll go to career fairs. I'll actually, shameless plug, be at the Long Beach Career Fair in I think 2 or 3 weeks. So come stop by, say hey. So yeah, we'll do that, and we'll talk to students and just say like, hey, what are your career goals? Do we see, maybe our program can be a good fit for you, especially if you're thinking clinical, this is a great opportunity for you to get that day to day and to see what it's like to actually be a part of a clinical team for a relatively, short time commitment, financial commitment, before you like commit to going to say nursing school or something like that. So that's a third of my job. Third of my job is the onboarding, training, clearance. So in terms of what I do, it's a lot of looking at spreadsheets. It's a lot of making calls and emails. It's a lot of making sure people are, submitting their applications on time and following up if they didn't. And then, conducting those interviews and reading through resumes and figuring out, are they a good fit for our program? And then, once they are admitted, following up like, hey, are you getting your immunizations in on time? Are you getting your CPR? All those other things that you need. And then we do in-house training ourselves. So there's one weekend where I'll come in with our entire leadership team. We take over an entire unit and we basically help them practically train how to do all the skills in order to be on the floor. So that's really fun because then I get to interact directly with all the incoming health scholars and work directly with our leaders. And I love that aspect. And then the last third of my job is kind of the operational day-to-day. So as much as we are a program where we want to provide an experience that is worthwhile and is, a resume booster and an eye-opening experience for those that are looking to get clinical experience, at the same time, I'm managing our relationship with our client, right? So I mentioned at the beginning, we're contracted to different hospitals to put on this program. And so how do I balance, I want to get these students their experience, but then I also have certain numbers that I have to, meet in terms of making our client happy and working with that relationship. And so that's a lot more of, looking at the data, looking at spreadsheets. We're here and this is our goal. How do we get from point A to point B? And I love that aspect too, because I love just seeing growth and development. And so, yeah, in terms of expectations, I think I didn't realize just how many different aspects there were in healthcare management in general, but especially in my role. And how many like small things that you need to think of, and how limited I am as one individual to be able to do things, especially if you're thinking management, delegating, and having people on your team that you trust is gonna make or break any sort of management career, because I would not be able to run this program if I didn't have amazing leaders that are able to do their job too. So being able to facilitate an environment where, they're not getting burnt out, they're enjoying the work that they're doing, but then are also trustworthy. And, at some point you have to hold people accountable too and say, maybe this isn't a great place for you too. So that's not the fun side of it, but a necessary part of running a program that is as big as ours. So yeah, so hopefully that's kind of paints a little bit of a picture of expectations versus reality. But like I said, you're never gonna really know until you're in it. Yeah.
Well, thank you for sharing everything that you did anyway, though. Okay, Nicole, over to you.
All right, so my day-to-day is very different than Emmeline's, but so basically I like to get to my shift a little bit early. Just I have a little bit of like time anxiety, so I get there early. We usually get shift report from the day shift because I work nights. Takes about like half an hour, and then I spend like a good maybe like 20 minutes or so just kind of like organizing my like shift together, just so I'm not all like clustered and like all over the place throughout my 12-hour shift. I go and see my patients and I do some vitals on them, a quick assessment, a head to toe, just to get like a baseline of where they're at. And then throughout the shift, I do another set of vitals for like 4 hours later, and then 4 hours after that. I'm giving meds, here and there, depending on when they're due. And then also letting my patients know if they need to call me if something, happens, they're in pain, or if there's a change that's happening, they can call me, and then I'm attending to them as, quick as I can. You make your decisions based on like the highest priority as a nursing school. Everything is a priority, but it's the thing that needs to be done first. So that's kind of like my day-to-day thing. And then at the end of shift, I get ready to, give my report to day shift, what they need to look at, and, things to kind of expect per patient. Because every patient is a little bit different. You're also interacting with doctors and, the patient's family and other nurses. I'm also interacting with my team lead if there's a problem during my shift too. It really just depends on like the type of patient, what's going on. You never really know what to expect when you come on shift. It can be like a really great shift, or it can be like just crazy. So it's, I feel like I was pretty anxious when I first started my position, but once you kind of get a hold of like the population that you're dealing with, depending on what hospital you're at, and like the unit that you're on, those kind of patients that you're expecting, I felt like you kind of can manage it a little bit better. As far as like expectations and reality, when I first started, it's like it was very different. I didn't know what to expect. Like I said, every specialty is so different that like, yeah, you get a taste of it kind of like in nursing school, but it is so different. And you can read as many things as you want and like prep yourself as much as you want, but it's never really what you expect or you're trained for. A lot of it is training on the job. I'm really lucky that I have such great coworkers. A lot of the time you do have that luck, and you really are relying on your coworkers to kind of help you out. You're never just thrown in there too, because that's what I thought when I was in nursing school. Oh my God, they're just gonna throw me to the wolves, and I'm eaten alive. These patients are gonna be like expecting everything, and I don't know what I'm gonna do. I don't know what I'm supposed to do, but you do get trained. You're not like alone for quite a while. You do have someone that's there for you every shift. I think mine was for at least like 2 months. So you are, with someone for a full 12 hours. They're there to answer questions, help you out. You go in with patients so that you're not like thrown off of what you're supposed to be doing, and then like you don't have someone to ask questions to. And even after that, I know for our hospital and our unit, we have what's called like a buddy. So afterward, when you are on your own, you can always ask them questions, ask for help. So you still feel like you're not just like, jumping off the like deep end. And even after that, they recently they have a role called like a staff developer, and they're more experienced nurse. So there are times like, even though I've been in this field for a couple years now, I still have questions, and things are changing every single day, and patients will ask me questions. And there are times where I'm like, that's a really good question. I don't know. Let me check for you. I'll go ask one of my like more experienced nurses on the unit, and they usually have a better answer for me. And then I can come back to the patient and ask or let them know what it is. But they never let you kind of just like throw you out there and just like hope you're going to do well. They all want to see you succeed, because, you're all part of a team. And if you're not succeeding together, you guys are all kind of failing together. So it's just kind of like, it's not like you're not fully trained in a certain unit until you're like on the unit, or you're in that specialty, or you're in like that clinic, or whatever you're going to be working for as like direct patient care role. So they will train you. They're not going to just, it's not like, it's like any other position. They're not going to just like let you go and not train you and, expect you to know everything, because you will never know everything. So don't give yourself, don't be too hard on yourself. And yeah.
Thank you. Okay, so we do only have about like 15 more minutes here for the panel, but I do have a few more questions that I want to get through. Okay, so Neda, what skills, qualifications, and/or qualities in a candidate do you look for when you're hiring?
So I'll split it between like healthcare and public health because I think it varies a little bit. So like with clinical positions, there's always like standard like licensures and certifications and things like that that are just required across the board. Like, for nurses or medical assistants, phlebotomists, things like that. Like there's always the specific, degrees, licenses, and certifications that are needed. And a lot of time, like in a lot of our positions, we don't necessarily require the experience, but we do require that you have to like get your like ASN and your RN license with your BLS, like things like that. So on the healthcare side, it's a little bit more simpler. On the public health side, because experience is always kind of prioritized over education, for instance, but I I think with public health particularly, we really look for like volunteer experience within the community. Like that's always what's really important, is that we want to see that you're putting in the work, especially for public health roles that are more like coordinators, like program coordinators, like things like that, that are a little bit, that are not maybe like management, for instance. Like we really just want to see the background of you working within those communities, even if it's volunteering or internship wise. But just having that like eagerness and that passion to kind of work within the community is what's really important. And there is like experience that typically is needed, but it's usually, we try to make it as like flexible as possible, because especially for the entry level positions, we want to hire entry level people who might not have all the experience, but maybe like did a lot of volunteer work in their time, or something along those lines. So, and yeah, and obviously like when I'm talking, if I'm interviewing you over the phone, or if managers are interviewing you, like just having that, just making sure that explain that passion and eagerness in the interview, like that always helps, because that's something that we prioritize, because anyone can have the experience, but if they don't really care as like that much about taking care of our like patient demographic, especially with the communities we serve, it requires a lot of patience and empathy and understanding. And, just not everyone has access to resources, or is working or is living in like the poverty level. Like there's just a lot that comes into it. So as long as you're explaining that and showing that passion and eagerness in those interviews, or even on your resume, like your cover letter, like however that looks like, that's really what is most important for us, is that you really care about the mission that we're trying to like do in this organization.
Thank you. That was really, really helpful. Emmeline, next question is for you. What are your top tips for students as they intern and work in healthcare? How would they increase their chances of being hired full-time or getting a great recommendation? And then outside of internships, do you have any recommendations for how they can increase their value as a job candidate?
Sure, yeah. I guess before I speak on the administrative side, I will say, kind of piggybacking off of what Nicole and I just described, I'm going to shamelessly plug my program too, because I really believe in the program that we provide in getting you guys into that clinical setting. Most volunteer positions in hospitals, you're usually just sitting in the gift shop, or like maybe wheeling patients around. The unique part about our program is that you're actually on the floor. You're working directly with the nurses, with the doctors, with the therapists. You're answering patient call lights. You're putting your gloves on. You're helping ambulate, feed, bathe. You're doing all the things. And so in thinking about a future position where you have to, like Nate was saying, speak on your passion, why do you want to do this? How do you know? You're going to be able to speak more genuinely if you actually have that experience to draw on, right? A lot of my scholars have seen mothers deliver babies and are like holding mom's feet up. Some of them have like seen, unfortunately, the maybe not so glamorous sides too, like in the emergency department of, bodies being bagged, or like, things like that. It's like crazy how much exposure they're able to get through our program. And so I would just, want to put that out there too, because I think it's a great opportunity for you guys to be able to see what it's like. And I'm gonna be honest, some shifts too, some parts of our program are, you're just taking laps around the unit, and like sometimes that's part of it too. It's not always going to be this crazy Grey's Anatomy type, healthcare situation. There's going to be downtime, and there's going to be, sides to it that maybe aren't as attractive as what you initially pictured. So just wanted to plug that for those that are looking for healthcare clinical side. For the administrative side, I would say just like any other business position, whether in healthcare or not, I kind of touched on this before, but your network and the opportunities that you get for like internships or just getting in front of people, shadowing, sitting in on meetings, whatever you can do it. Because the more exposure you get and the more experience you get, the more you're going to be able to speak onto why you want to be able to do this. So in terms of my past experiences, so I did a handful of internships in college. I did this program first, which was kind of my first step into that. And then in college, networking. I know networking is kind of like this big term that people throw out, but don't really know what it actually looks like on a practical level. For me, that looked like I talked to my very first boss when I was in this program and was like, hey, I'm really interested in exploring this. Do you have a connection that I could talk to and ask them more about it? And then she referred me to them. And then I set up time with them, 20 minutes, coffee chat over Zoom. Hey, tell me about your day-to-day, kind of the same questions that we've been asking here, right? And then saying like, hey, but I haven't really explored this side of healthcare administration. Do you know somebody there? And then they would refer me there. And so just kind of continuing this chain of, hey, I'm just gaining more knowledge, but I also have network that I'm adding to my LinkedIn that I'm able to follow up with, and will be able to get you those referrals in the future for a job if you're looking for it. So I think kind of different from maybe the nursing or clinical side, you really have to go about it in a like business minded way if you're thinking about more the administrative management side. And I would also say, I obviously having come from the Health Scholar program where I did clinical work, I will say now that is a invaluable experience to me being on the management side, because higher ups, like once you get to C-suite level, like CEOs, CFOs, whatever, they're all MDs, they're all nurses, they've all done the clinical work. And so for you to not have that clinical experience that's hands-on puts you at a disadvantage already. But for me, I was able to, in again, relatively short amount of time, be able to understand what it's like to be on the floor, maybe not to the same extent as Nicole, but at least get some exposure to be able to speak on it, where that's not a limiting factor now for me to be in management. I'm able to understand what the nurses and the therapists do and be able to understand the perspective more and bring that business mind in order to, as my strength to combine with their strengths from those that come from the clinical side. So, yeah, network, get yourself out there. Don't be afraid. I know it seems scary. I know we probably seem scary to reach out to too, but trust me, we were all there. And we love to impart, what we've learned and want to help you. So don't be afraid to reach out. The worst thing that you could get is a no. And that's not the end of the world, So yeah, I would just really encourage you to put yourself out there and get yourself those opportunities.
That is such good advice, Emmeline, that just the worst thing you're gonna hear is no or no response. And that's just it's not a bad thing at all. It's kind of the name of the game, it's a part of the process and the journey that all of us have gone through at some point, I'm sure. Okay, so kind of as our last, as the last question, I'll ask it to all of you. So, a lot of the students here are juniors, seniors, they're about to graduate, they just recently graduated. So like very practically, what are popular entry-level job titles that our newly graduated students should be looking out for on LinkedIn, on different job boards? If there are other job boards specifically for jobs in healthcare and you are aware of them, please tell me. But yeah, if you can all kind of each share like what they should be looking for as next steps if they're just graduating from their bachelor's degree. Nicole, we can start with you.
I would definitely look for like new grad positions. I know there's a like a forum, or not forum, like a group on Facebook I joined. I talked about like it's just like specifically for Southern California, and it would list things for new grad positions because there's a bunch of everybody that are still like they're all looking for the same thing. And like I said, just like in nursing, everybody just wants each other to succeed. So there'll be like constant updates for like when things are updated and like when jobs come out, when to expect them. Usually they come out, I think some of them are like once a year, some are twice, and some are 4 times a year, just depending on the hospital. And then sometimes depending on the hospital, it will depend on which units they're going to be, you know, sending out positions for. I know my unit sometimes will say we're not hiring this, you know, quarter, but we'll be hiring like 5 the next quarter. So definitely looking for a job that says new grad. The new grad programs definitely are like so great when trying to get you just into the program that give you lots of information, lots of education, that nice transition from being a student to being into that clinical atmosphere. And then I mean, there are other jobs too you can look for as well that just say like entry level nurse, but that new grad or like new graduate position is really going to be that one that you really want for.
You, Netta, you want to go next?
Okay, so speaking to my organization specifically, as far as like entry level positions, so we do have like quite a few different coordinator roles. Some of them do require some more experience than others, so you have to just kind of like keep an eye out and read what those requirements look like. But there are quite a few that don't require too much experience and that you can kind of come in pretty like green, for instance, as far as like what your experience looks like. Also like front office positions that we have available, those are pretty the most accessible ones, especially if you don't have like clinical or public health experience. And with our organization, once you're already working within our organization, we always prioritize promoting within versus hiring like outside. So it's like I've seen a lot of employees here start at entry level positions and then they end up getting promoted to like more direct like outreach public health related positions like case management, housing, like things like that, but they started out as like a coordinator, like a referral coordinator or something like that, where they're just, it's a little bit more data entry focused, but it's a great way to kind of get that experience. And even in the front office, when you're working in our clinics, you get that like clinical experience of like learning how to, you know, do patient registration, how to work our programs and softwares that we have. Like that's a lot of good experience that you can have that is a good stepping stone. So yeah.
Emily?
Yeah, I think a lot of the titles that Nita just threw out are very similar. Coordinator positions, analyst positions, if you're thinking more data. Yeah, the receptionist positions. I would say I think we're pretty aligned there. I will also say if you don't have any experience, I think internships are probably a great way, especially in this kind of market right now too, to just get exposure and something to put on the resume, something to draw upon. And this may not be the advice that everyone wants to hear, but don't be too picky. I'm going to be honest, coming out straight out of undergrad, you really just need experience on your resume. You really just need to get in there and have something to speak on. It may not be your dream job. I'm going to almost guarantee you it's not going to be your dream job straight out of college. But that's just part of the growth, right? You just need to take that next step in order to get to where you need to be. And so like Nate was saying, a lot of companies, especially in admin too, they all promote internally. And so just start out, get those skills, the hard skills and soft skills, get your extra degrees if you need it. Take advantage of the time that you have when you're early on and maybe not responsible for as many tasks and you have a little bit more time. And yeah, just get that exposure. Don't be too picky. I know it's not what everyone wants to hear, but I think it's sometimes what people need to hear. Yeah.
No, I could not agree with you more, Emmeline. Yeah, I didn't get my first favorite job out of college. I think it's a very idealistic view and I completely understand why we want to have our dream job immediately, but that's just not what the reality is. So it's really good for our students to hear that. Yeah, everybody goes through that for your first even possibly few positions that you ever have. Okay, so that being said, we do still have a few more minutes to ask questions. Now would be the time if you would like to ask any of our panelists a question. You can either use the raise hand function or you can drop the question in the chat. But I'll give you all a few minutes to do that if anybody has any specific questions. And I will be sharing their emails after this as well. So if you would like to do that instead.
Yeah, while we're waiting for that too, Heather, I'll just interject. You guys being here is a really, really great first step. Like you guys are already ahead of the game, gaining knowledge from other people, just attending and, gaining, a different perspective that maybe other people don't have. So I want to encourage all of you too. You're on the right track. Keep going. This is definitely a great first step for you guys.
I couldn't agree more. Okay, so we got a question saying, I believe MPH is a master's in public health graduate student. In my first semester, what skills should I work on? And I'll throw this to any of you, maybe. Emmeline, that might be a little bit better of a question for you two to answer.
Yeah, that's a good question as far as skills. I think because you're in your first semester, skills, that's I'm like trying to think of what I can possibly specify. I would just go back to what I've said before in the sense of like any kind of volunteering, like skill set in the sense of just getting knowledge and experience in the community, like however, like whatever that looks like whatever part of the public health you want to work in, whether it's housing or just social work in general, like just trying to get that knowledge and experience in any way that you can, just to kind of understand how it works. So, and even like if there are free like certifications like you can take online, like additional things that you can do to kind of gain that knowledge, especially locally, right? Because like every city is different, every state is different. So just understanding like LA and LA County and what that community looks like and what our housing crisis looks like and all these different aspects of it, and just having that knowledge, which you'll probably learn in school too, but just having that extra, that's probably the best thing I would say. Because in a lot of public health positions, it's a lot of work. It's like it's not always rewarding, but it is rewarding ultimately, but it is a lot of work. So just like understanding that and getting that experience will give you more of a leg up.
Thank you. Someone had asked if they can connect with you on LinkedIn. I'll leave all of you to answer that for yourselves.
Absolutely. Please do. My name's
Yeah.
pretty unique, so you should be able to find all of us, I think, for the
Same.
most
I was
part.
gonna say you're not gonna find
Yeah.
many of me on there, I think so. Yeah.
Agree. Okay, so we had another student that says, I am an undocumented student looking to apply to PA school. I'm having difficulty earning paid direct patient care hours. Any advice on finding stipend or granted opportunities that may provide direct patient care experience? And Emmeline, actually with your program, do they have to be a US resident?
So, like I mentioned before, we contract with different hospitals. So every hospital has a little bit different of criteria for the interns that
Okay.
they bring in. My site at Hoag, unfortunately, we don't. But I know there's plenty of spaces at, I know there's MLK Junior in, I think, Compton. There's Kaiser Permanente in Anaheim, which is pretty nearby, and then all across California. So actually, in the other question about our program, I linked our website, all the locations you can find on there. So it'll be kind of different depending on the site. Yeah, I would say just based off of my general knowledge of it, maybe Nicole can speak to this too, but I think most entry level paid clinical experiences are like scribing positions, or like in like coordinator positions, if you're thinking more the admin side. But I don't know if there's any like scholarships or things like that you're aware of, Nicole, that I'm not too sure about.
I'm not sure like on the medical like doctor side of things, just because like our programs are so separated, especially when I was going through school. They like you said, Emily, there might be like some like scribe or like medical assistant type positions too, if you're looking for some like experience and some like paid opportunities. I know that there's a bunch of them in like clinics, and there's also a bunch in like the ERs and things like that, where doctors are very fast paced and they need some extra hands. That's as far as I know. I wish I had more information.
Oh, no worries. That I think that was still helpful. Okay, Netta, this may be a good question for you. Someone asked, while interviewing, the salary expectation question can seem a little awkward. How can you properly answer it? maybe, or like, how do you ask a question about salary expectation? And then if they share it with you that the salary is lower than you were hoping, how would you maybe go about asking for more?
Yeah, that's a good question. So, I mean, thankfully in LA, we have to post the salary ranges on our job posts online. So most of the time, we don't really, you usually should, I mean, for us specifically, and usually in LA, you should know what the hourly or salary range is for that position on the posting itself. So, but if you do, I mean, I personally like, I feel like there's always like this back and forth of like you can't ask, but I think that you should. I don't think that there is like a stigma around it, but I don't think that you are ever penalized because in the beginning of like especially in the first interview, you deserve to know what you're going to get compensated for this position. Like it doesn't have to be like a workaround or like a whatever. So I honestly like don't mind when people ask me like what is the pay range for this position, like just being completely straightforward in that sense. And they shouldn't have any issue answering. I think if they do, I would take that as like kind of a red flag because like I don't know why they aren't giving you a set like range at the very least, or at least telling you where it starts. And if like you're offered the position or if maybe it's a little bit like lower than what you wanted, you can always ask, is there any flexibility with this pay range? Like with my years of experience, is there any room for negotiation? Most of the time organizations can't really like they can most of the time there should be some sort of room, but sometimes there is only a set pay rate and there's not a lot of wiggle room. Again, if you ask these questions, don't be afraid to because these managers want to know, like they don't want you to like the last thing that they would want is for you to be like, okay, yeah, sure. And then later, you're like, actually, I don't like the pay. Like I think that we should all try to be as transparent. And this is like on our end too, like being just transparent in the interview regardless, so we can kind of avoid things happening later. But yeah, it is always awkward, but don't feel awkward because it is an important question. It's very important because we all need to pay rent. We all need to make, we have bills. Like we can't sit here and act like we can get paid, whatever, and it's okay. So just yeah, I usually don't. I encourage people to talk to me about it. I always bring it up because it's an important thing to know in the beginning. So yeah, I hope that answered your question.
Thank you so much. So everyone, these questions are amazing that you're dropping in the chat, but we are at our time and I want to be respectful of our speakers here. So I'm going to quickly share this QR code for a survey. If you all wouldn't mind completing it before jumping off, I would greatly appreciate it. Let's see, I'm also going to drop it in the chat for everyone. And a reminder, if your question did not get answered today, I will be sending around to the attendees our panelists' emails, so please feel free to email them directly. I think they all said that you can request them on LinkedIn as well. So thank you again all for being here. And another reminder, so APLA Health and the COPE Health Scholars Program. So Netta and Emmeline will both be at our in-person job fair that is coming up in 2 weeks. So if you would like to speak with them more, please come to the job fair. I'm sure they'd be able to answer any of your additional questions also in person. In fact, I'm sure they'd prefer to answer your questions actually in person and get to shake your hand and meet you, maybe check out your resume. So please turn out for that. And this video will also be posted on the CDC's YouTube channel. So if you want to rewatch it because you missed some things or whatnot, or one of your friends had to drop off early, please direct them towards the YouTube channel. But other than that, thank you everyone for joining today. Netta, Emmeline, Nicole, you guys, this was invaluable. Thank you so much truly for joining today and giving us your time. I see everyone is saying thank you in the chat. So you guys are getting a lot of love and gratitude. With that being said, if you guys want to jump off, you're more than welcome. If you want to hang back, whatever you'd like to do, but I will go ahead and stop this recording. Or actually, Marianne, I